Good morning, everybody. 11:15 in the morning, which actually, to be honest, we're about 30 seconds away before the clock actually strikes 11:15. And yes, it's me, Anil, on the mic. I'll be the host for this special interview feature, which is Health on Tracks, which comes on every Mondays in the second hour of the show. And today we're going to speak about something that's very interesting. This one goes out to all the amazing women who are navigating their life in their fabulous 40s, and they've taken that one giant decision to embrace motherhood, a new adventure in their lives. And to help us understand the topic that we're discussing today, which is maternal health in pregnant women above 40, I have on the phone lines consultant obstetrician and gynecologist at Pantai Hospital, Ampang, and she's none other than Dr. Sudha. Dr. Sudha, good morning.
Good morning, Anil. Good morning. Thank you for having me.
The pleasure's ours. Welcome to Health on Tracks. Okay.
Thank you, Anil.
You're welcome. All right. Now, Doctor, as you know, as we know, the decision to embrace motherhood at an incredible stage in every woman's life is a big decision, giant decision, and sometimes as they get older, as we all know, there are lots of risks that also come into the picture. When you are embracing motherhood, when you want to get into pregnancy, and you're going to help us, understand this topic better, maybe debunk some of the fallacies and the myths that are out there, perhaps, and also enlighten our listeners on this subject. So perhaps before we start off, Doctor, could you give us an overview on about yourself, your expertise in the field of obstetrics and gynecology, and particularly pregnancies concerning women above 40, your expertise, Doctor?
So, Anil, I've been in this field for almost 15 to 18 years.
Okay.
So the moment I finished my housemanship, I immediately went into obstetrics and gynecology.
Mm-hmm.
And I specialized and I graduated from University of Science Malaysia in 2014 as a specialist. And I've been serving the government right up till 2021 before I left to Pantai Hospital, Ampang. So yes, I do see a trend these days of women getting pregnant a little bit later as compared to when I first started work as a very young houseman. So this, of course, has a lot to do with work, and also, many women out there are in the workforce these days. They need to make somebody out of themselves.
Yeah.
And so by the time they climb the ladder and by the time they establish themselves, and then they decide that, okay, now I'm ready to have a family. But having said that, in our Asian population, there are still a vast number of women who actually get pregnant younger, but I must say that there is an age shift from 20 plus to about 30 plus now. So the common age now is around 30, 28, 32. That is the common age that I usually see in my practice. And with age, of course, comes multiple other risk factors, and it all depends on how we are in terms of our health throughout that very, very important year.
Yeah. So you touched on my next question, which is understanding the risks, Doctor. So for our audience out there who are eager to understand more, please help us understand and shed light on some of the specific health risks or the considerations that need to come into play when a woman decides to start a family at the age of 40.
Okay, Anil. So one of the main concerns is, of course, the fertility status of the lady, right? So as we age, our fertility, of course, is lowered. It goes down because, simply said, that our ovums or the eggs are as old as us, are as mature as us, rather. So the number of ovums actually decline with every cycle of our periods, our menses, right? So by the time we are 35, the number of eggs definitely would have gone down as compared to when we were younger. And it gradually keeps reducing. And of course, with this, because like I said, they are almost as old as us, the quality of the ovum also tends to decline. And due to that, during the differentiation process, issues can take place during the differentiation, and that's how we come about some chromosomal abnormalities and some abnormalities that can happen with the baby. Other than that, at this age, at 40 and above, very commonly we see women having endometriosis, especially adenomyosis, fibroids, and these kind of things can also impede fertility. So that is one factor. Other than that, women at this age actually have a higher risk of developing gestational diabetes mellitus, meaning diabetes that you get while you are pregnant.
You're pregnant, yes.
Or, yes, gestational hypertension, and going on forward to preeclampsia, which is a complication of the hypertension. They may be anemic, wherein their hemoglobin is lowered. So these are some of the things that they may face. Other than that, usually after 40, we are more prone for chronic illnesses like the diabetes and hypertension, not gestation related, right? So we are at a higher risk of developing those kinds of conditions, which can actually impact the pregnancy and also the growing fetus, right?
Dr. Sudha, sorry to interrupt you. You mentioned something very interesting, and I think that probably lit a light in the minds of a lot of our listeners. Gestational diabetes. You spoke about that. Sometimes when a woman is pregnant, right, and she gets a lot of love from everyone around her, they're feeding her, and the love is always overwhelming because, like the saying goes in Tamil, right? If you want your child to grow, you better look after the woman who's bearing your child, and then she gets that love. And then when she gets, and when a pregnant mother gets told that she's, potentially having gestational diabetes, wouldn't that lack of nutrition affect the baby in the womb?
No, Anil. So we have to get one thing right first.
Right.
When we are pregnant, we don't have to eat for two. We still have to eat for one. Okay? Which is the mother. But it has to be a very good and balanced diet, right? Okay. So when we have been diagnosed to have gestational diabetes mellitus, the changes that we need to do is actually more towards a very much more healthier diet, wherein we need to cut down the portion of the carbohydrates and increase the portions of the proteins and fibers and all those good stuff. So in that way, we are actually not impeding the diet, nor are we going to affect the weight gain of the mother, nor are we doing anything that will impede the growth of the baby. Because in fact, now they are practicing a much more healthier diet compared to all that love diet that they are given. Like, eat anything, eat two of it, it's okay, you're eating for two people. Oh, you really feel like having you must give it to her, otherwise the baby will start drooling.
Yes.
So they have all these things.
And husbands go high and low just to make sure they fulfill their wives' cravings when they're pregnant.
Yes, and they put on weight. Husbands put on weight. Because wives will take a little bit and pass the rest over.
Yes, doctor, yes.
Yeah. So that's answering to that. So going back to the risk of pregnancy at 40 and above, so now let's go to the fetal risk. So one of it is miscarriages. Now miscarriages can occur at a rate of about 40 to 50% when our age has gone up beyond 35 to 40 years. And most commonly, this is because of the fetus itself that has been formed. Maybe it's abnormal, and it's the nature's way of actually, getting this fetus out of the uterus. And chromosomal abnormalities like Down syndrome, I think the most common, which a lot of people know about, are also very, very common. There is a twofold increase between the age of 35 to the age of 40, and it just keeps increasing. And among other syndromes are like Patau's and Edwards syndrome. Babies can have structural abnormalities, wherein you may see cleft lip, cleft palate, and all other kinds of abnormalities. They may have a preterm delivery with a premature baby. And the baby may also have some growth issues, wherein they may be either too small because of impeded growth, or sometimes when they have medical disorders like diabetes, it could cause the baby to become very, very large. So these are some of the possible risks and complications that they may encounter.
Okay. Thank you very much for shedding light on that, Doctor. Now that we understand the risks, maybe what we'll do is that we'll take a quick break, and when we come back, we'll try to understand a little bit more on some of the antenatal tests that are out there on how women at the age of 40 who are pregnant can reduce the risks of, having birth defects and so on. Okay, Doctor, let's go in for a quick break, and when we come back, we shall resume with our discussion. Tracks. I'm Anil on the mic, your host for this segment. And on the phone lines with me today, I have Dr. Sudha, who is a consultant obstetrician and gynecologist at Pantai Hospital, Ampang. And on Health on Tracks today, we're speaking about maternal health in pregnant women above 40. Dr. Sudha, welcome back to Health on Tracks.
Thanks, Anil.
Okay, Dr. Sudha, so earlier on, before the break, we spoke about the risks of birth defects for pregnancy in older women. Now, could you share with us some of the antenatal tests that can be done to screen to avoid any birth defects, Doctor?
Okay. So initially, Anil, we used to do something called the combined testing, wherein a nuchal translucency used to be done, which is actually a scan in the first trimester of the thickness at the posterior part, at the back part of the neck of the baby, combined with some blood tests in the early second trimester. And together with this, we come up with a risk score. However, in this time and day, we have moved on from that to doing what we call an NIPT, which is actually a non-invasive prenatal testing. As the name suggests, we just take the mother's blood, and the cell-free DNA of the baby that is present in the mother's blood is then collected and tested for certain common abnormalities, like Down syndrome, Patau syndrome, Edwards syndrome, and many other micro-deletions. So there are many companies who actually run these tests. And then they come up with a risk score, and then they will tell us whether the mother is high risk or low risk for those particular syndromes that they have checked for. This is a screening test. And then this is done around 12-13 weeks of gestation. And then there is the structural scan, or commonly known to many patients as the detail scan, that is done at about 18 to 24 weeks. Now, this scan looks at the detail of the structural features of the fetus. So they will have a look at the brain structures, facial structures, and see whether there are any abnormalities and whether any of these abnormalities actually could be related to a syndrome. Now, whether it is the NIPT or whether it is the structural scan, if they find that the NIPT shows that it's a high-risk result for Down syndrome, for example, or the scan finds that they are finding, for example, like absent nasal bone and low-set ears, single palmar creases in the hands of the babies, then what they will do is you will need to do a diagnostic test, which is the amniocentesis, which is where they take the fluid from the water bag.
The amniotic fluid, yes.
Yes, the amniotic fluid, and that is to run a diagnostic test to confirm whether the abnormality is there. So the common screening test would be the NIPT, which is very largely available now as compared to previously, and the structural scan.
Doctor, you spoke about the amniotic fluid. I was reading a lot about this recently because something that relates to that happened in my life. But can you give us a perspective of how important is the amniotic fluid and how is it formed? How does it get replenished in the mother's womb?
Okay, so in the initial stages, the amniotic fluid actually is produced by the placenta itself, and then as the baby grows, this is nothing but 80 to 90% of it is actually the fetal urine.
Right.
The fetal urine.
I see.
Yes. And there is some contribution from the placenta as well, but a large portion of it is from the fetal urine. That's why I know if the baby has got any kidney issues, right, the amniotic fluid might be reduced. If there are swallowing issues, obstructions, then the fluid might be a lot. If the mother is a poorly controlled diabetic, then a lot of the glucose that is passed on to the baby then comes out with the urine of the baby, and the volume of the urine that comes out is a lot, and then there'll be a lot of fluid. So these are some of the factors that may contribute to too little or too much of fluid. So it's because it is all dependent on the fetal urine. So that is how it keeps getting replenished. Swallow, pee, swallow, pee.
I see. So for women who are in the in their 40s, how susceptible are they for any form of defects when it comes to maybe leakages in amniotic fluid and so on, Doctor?
Yeah, that is okay. Very, very commonly, leakage of fluid happens because of an infection. That is the most common cause of leakage of fluid, other than them going into labor and then having a leakage of fluid. So I don't think this is very much age-related, the susceptibility to the infection. infection. But I think that is a common thing that can happen to women in any age group, and it is not very much related to the age. However, the abnormalities per se, if you say that it's very reduced because of a fetal anomaly, then of course it might be slightly higher in a lady that is a bit older compared to the younger age group. But ironically, we do also see it in women of the younger age group because this is sporadic. It can just happen.
It can happen to any pregnant mother.
Yes, it can.
Right. Now let's talk about the balancing act, doctor. Of women having personal aspirations. They have aspirations of succeeding in their career, and at the same time they've made this leap. They've made a decision to start a family, and it can be a challenge that lots of women face. So, in your opinion, doctor, how do you think can women approaching their 40s strike that perfect balance, between pursuing their professional goals and also at the same time focusing on having a healthy pregnancy, doctor?
Okay. So, I think one of the main things, the first thing that we need to take into consideration is in these current times, there's a lot of stress in whatever a lot of them are working. That's the common complaint that I get. So we need to be able to balance out that stress, because stress doesn't help in anything, not in our health, not in our pregnancy, not in anything. So we need to strike a healthy lifestyle in terms of our diet, in terms of our exercise, in terms of our stress levels. And touching on the health topic, we also need to ensure that we optimize our weight before we embark on the pregnancy journey, because obesity or being underweight, especially obesity, comes with its own complications in pregnancy. Now, the second thing I'd like to touch on is in women at this age group, if they have any chronic illnesses like diabetes or hypertension, or if they're on any long-term medications, whether it is for those conditions or epilepsy or anything of that sort, the control of the condition, the illness, has to be optimized. It has to be optimized. That means very good sugar controls, very good blood pressure controls, and also the medication that they are taking needs to be changed to those that are safe in pregnancy, because they know they're going to embark on this journey, right? Now, the third thing will be starting folic acid, 5 milligrams a day, about 3 months prior to planning to get pregnant. Yeah? So
Folic
this
acid.
helps reduce, folic acid. This helps to reduce the risk of neural tube defects in the fetuses.
Okay.
Compliance to antenatal follow-ups is very important. They should make time for it and not say, "Oh, I'm too busy. I've got this project. I've got that."
And
so I can't come for my follow-up."
hold on to that legendary pink book and take it along with them as well.
Yes, like your identity card.
Yes.
Like your identity card. I always tell mothers to carry that like your identity. You can forget everything else, but not the book.
Not the pink book.
Okay, not the pink book. Okay, and also compliance to necessary screening tests that might be recommended for the mothers. For example, blood sugar test or modified oral glucose tolerance test. Some of them will say, "Oh, I don't want to do it. The taste is terrible." Yes, but these are some of the tests that need to be done, and I really strongly advise them to follow the recommendations with regards to medication intake, dietary habits, especially if they have pre-existing conditions, and the advice that we give. Most of them actually are very, very compliant to all this, because they are fully prepared when they come into this journey at this age, most of the time, as compared to some mothers who are younger. But having said that, all these things need to be, must be focused on in order to help them to have this healthy pregnancy journey as much as possible.
Okay. A very good holistic approach, right before the pregnancy begins and then all the way up to the pregnancy as well.
Yeah.
Great. Thank you, doctor. Thank you. I tell you what, doctor, we'll go in for another quick break, but just as a teaser for our listeners who are tuning in, you can actually catch this interview live on our official Facebook page at Tracks FM Official. And if you have any questions, yes, our producer Juliana is here right here on the handling the live stream panels, and she can pick up your questions and we can throw it away to Dr. Sudha to answer them. But when we come back in the next break, we're going to debunk an age-old myth, and maybe it's a fallacy, of whether coffee is said to be bad for pregnant women just simply because of the caffeine content. We'll get Dr. Sudha to answer that after a quick break, so keep it right here. Health on Tracks with me, Anil, on the mic. Anil on the mic. Joining me on the phone lines is Dr. Sudha, a consultant obstetrician and gynecologist at Pantai Hospital, Ampang, and today she's speaking to us about maternal health in pregnant women above the age of 40. Dr. Sudha, welcome back to Health on Tracks.
Thank you, Anil.
All right. Great. So, Dr. Sudha, we gave a teaser for our listeners earlier on before the break. About coffee. We all love our favorite cup of joe. And so is our favorite cup of joe good for pregnant mothers or not? Debunk it.
Okay. So studies have shown, Anil, that actually a high caffeine level can actually affect the growth of the fetus, wherein the baby can be small. The growth can be affected, poor quality of growth. But having said that, we are actually allowed about 200 milligrams of caffeine a day. That is safe. That is a safe range to have. So I would say it's very safe to say that maybe 1 cuppa a day is all that you can take.
Okay.
And it's a safe amount because we have to take into consideration caffeine in other foods and drinks that we have, like hot chocolate, milk chocolate, dark chocolate. All that actually has caffeine.
And
right?
tea too.
So, yes, and tea too. So 1 cup a day should be fine. I always tell my patients that.
Okay. So just like an apple a day keeps the doctor away, a cup of joe is okay. It's just considered okay.
It's okay. It's considered okay. Yeah.
Okay. Now let's talk about childbirth for pregnant women at the age of 40, doctor. So, what does science say when it comes to delivering the child? Which is better for women at the age of 40? Do they, just go ahead and opt for a C-section, or which is better, C-section or normal delivery? Just to because I know that the way doctors think, or gynecologists think, is that when a mother is pregnant, they always prioritize the mother first. As far as the mother is concerned, she wants to see her baby.
Prioritize the baby.
Yes.
Yeah, that's right.
Yeah. So give us the perspective.
Okay, Anil. So, there is no right and wrong here. Okay, if you ask me, natural birth, normal delivery is always the best. It's always the best, right? However, it very much depends on the risk factors that we are dealing with at hand, whether it's maternal risk factors or fetal risk factors that we need to take into consideration when making that decision whether one can have a normal delivery or not. Normal delivery, for example, is pretty unpredictable, right?
Yeah.
Baby may go into distress at any point in time, or the delivery while in labor may not progress, and then we end up in an emergency cesarean section, right?
Yeah.
So we must understand those things. And before we make that decision on the mode of delivery, we have to take into consideration, number one, for example, one of the main things that I would consider is the conception itself. Was it a natural conception? Or did the mother have to go through IVF or multiple IUIs before she got pregnant? Now, the more difficult it is for her to get pregnant, the more we will err on the safer side, and we may advise her to go for a cesarean section as compared to someone who, when she planned to get pregnant, she naturally just got pregnant and everything is going very smoothly. There is no risk factors in the pregnancy. Mommy is fine. Baby is fine. Then I don't see the reason for her to have a cesarean section. But if she has preeclampsia, she has placenta previa, or there is a growth problems with the baby, too big, too small, these are all the things that we will need to take into consideration before we decide on the mode of delivery. So if you ask me, other than conception, all other indications for a cesarean section would be similar in a woman younger than 40 or a woman older than 40. And one of the main things that we look at is always the method of conception, which is going to definitely change our decision and our counseling towards which mode of delivery would be better for her. At the end of the day, Anil, it is always the mother's choice, but she must understand what are the risks that are at hand.
Right, okay.
So it is not a definitive 40 and above cesarean section. No, that's not a hard and fast.
Right.
Not at all.
Right, okay. Right. Okay, we got that out of the way, and I think our listeners have some clarity on that. Thank you very much for shedding light on that, Doctor. Now, let's talk about supporting women. The awareness out there about giving them the right amount of support. Doctors always give advice, to husbands who have a pregnant wife, and say you have to emotionally support her, you have to keep her happy all the time, and part of which is also giving her all the food that she wants. Never upset a pregnant woman, because I would say if you upset a pregnant woman and she's upset, then your baby will be, very, very upset as well. So you got to keep the baby happy, right? And in lots of cultures, societal expectations around childbearing as well can be very pronounced. Sometimes it's the pressure that comes externally that puts a woman in a situation where, oh my goodness, everyone's asking me, you're married but no baby, married no baby, okay, and then these things happen. People around us, sometimes we have no control over that.
Yes.
How do you think communities and families and people out there can offer support in raising the awareness about maternal health that comes into play, Doctor?
Okay, Anil. This is a very valid point that you have brought up, which I always discuss with my patients. Yeah. So I always tell them that number one, whenever you have any doubt, because in the community, like you say, everybody will have something to say. Oh, your tummy is too small. Your tummy is too big. Are you sure it's a boy? Are you sure it's not a girl because the tummy looks like that? Oh, you're not gaining weight. Oh, you don't eat this. Oh, you're not doing that. Oh, why is it like this? Oh, when I was pregnant. All these things come into play. So I always tell them that when they have any doubt, the first thing is that they should be talking to the obstetricians and talking to us and telling us, what is it that you're doubtful of? What are the comments that, you're not sure? And how do you act on that? And those kinds of things, number one. Number two, as for the husband, yes, it is very, very important for them to support the wife through the pregnancy. Simple things, Anil, like coming for the antenatal follow-ups with them, understanding what's happening through the pregnancy, and what are their do's and don'ts, what are the precautions, and just showing that you are there. I think that is very, very important, especially so after delivery. That is one of the hardest times for a mother, a first-time mother, to adapt to this very, very different kind of life that she has to now suddenly embrace, right?
Yeah.
And but in all of that, I always tell the mothers, more important than the husband's understanding, you should be able to tell them how you feel or what you want, because you can't expect them to just know.
Yeah.
They are not going to just know what you need and just know what you want. So you got to share with them. You got to tell them how you feel. You got to tell them when you're stressed. Not try to do everything on your own. As for the family, I think it is good to be seen as supporting the couple, supporting their decisions, supporting their journey, instead of always questioning, discussing instead of telling. I think these are very, very important things, because if you can hold a conversation with them and discuss the situation as compared to telling them you must do this and you must do that, it actually makes them feel better, and they feel that you are giving them some kind of respect and responsibility when it comes to their own pregnancy and their journey. And family support is of utmost importance, if you ask me, especially after delivery. Because yes, it is very tough. I always tell my mothers that mummies are heroes with capes that no one sees. After cesarean section, day 2, they are up, they are feeding the baby, they are moving. The moment they go back, they are doing a lot of things. Even in a normal delivery, you have just had a big baby coming out of you, and you've got stitches in your perineum, and you're moving, and you're getting things done. All these things, this strength that you have comes so much from within, your maternal instinct. However, you get tired, you get frustrated, baby is not latching on well during breastfeeding. So you have to communicate this to the family around you and ask for help when you need it. Otherwise, you're going to go down that road, you're going to get depressed, and postpartum depression is very, very real.
Yes.
So you really, really need,
absolutely,
when you need help, you just got to ask for it, and don't stop yourself from saying, I'm tired. Don't stop yourself from saying, I need help. It doesn't make you any less a mummy. It doesn't.
Right.
In fact, it makes you a stronger person.
And I think, Doctor, for the many men who are listening out there, I think you gave all of us, a direction of what we need to do, for us to eliminate any sort of, confrontation or conflict when you're dealing with a wife who's going through postnatal depression, which is to tell them to talk to us. You have to talk to me and tell me what's going through your mind, because I'm never going to read your mind until then a mother's talk, right? And
absolutely.
Now let's talk about traditional confinement in Malaysia. It's the thing that is done by most mothers as a form of postnatal care, which is to restore physical health, mental maybe. But from a medical standpoint, doctor, how important is this practice of confinement care after delivery? Okay,
so even in medical practice, confinement period is 6 weeks post-delivery, right? That's about 42 days. So pretty much that is also what is practiced traditionally, and some practice up to 100 days. So in my opinion, there are many, many good practices actually that do not bring any harm, and there are some amount of benefits to it actually, but there are some practices that might not be the best. So let me give you some examples. For example, when we are postnatal, timely meals. Our parents will make sure you eat on time. The confinement lady will make sure your meals go in on time, and you don't skip any meals, because you see, you are breastfeeding, right? So the quality of the milk is all going to depend on the quality of food that goes into your system,
Right.
and how timely is the food going into your system. Because this is all going to come out into the breast milk to the baby, right? And high protein foods like fish, veg. You know, the Chinese have these soups with the red dates. Those are all actually good for recovery, whether you're recovering from a cesarean section or whether you're recovering from normal delivery. The high protein content is really, really good. And turmeric, Indians use a lot of turmeric. Now, turmeric, we all know, has antiseptic properties, so which is all great, actually. It's really, really good. It is a good source of protein. It is a good source for tissue recovery. It is a good source of antiseptic, which is great. Now, massaging. Massages, I think every mother needs to be massaged, whether they had a normal delivery or whether they had a cesarean delivery, only because the whole pregnancy has taken such a toll on their body.
Absolutely.
And normal delivery takes another toll on their body. These massages are so calming, it relaxes them, and I think it does them a lot of good.
Okay.
Now, going on to some of the practices that I don't really think is right is, for example, not allowing consumption of water, adequate amounts of water. Now, that is not advice. Number one, that reduces the amount of water that's actually going to the baby, right, in our breast milk, right? So that causes the baby to get dehydrated, and then jaundice will go up. Jaundice will worsen. And also, when there is not enough fluids in our system, when a woman is pregnant and within the 6 weeks postpartum, they are at a higher risk of getting clots in their calves that can actually move on to the lungs. We call it deep vein thrombosis.
Right.
It can end up with pulmonary
So that's why they
embolism.
get that swelling on their feet.
That's right. Swelling on the feet, no, that is edema. That is dependent edema.
Okay.
This is swelling of the calves that are very, very painful.
Calves.
Okay, and this is because there are clots in the veins. Now, that can be avoided if you hydrate well, if you mobilize well. So you need to drink good amounts of water. And then some of them are not allowed to move around. They are asked to just take bed rest. Now, all this will increase the risk of the deep vein thrombosis. Now, the other practice that I'm not too happy about is when they are not allowed to bathe or use the fan. Because they say the angin will go into the body
Masuk
and
angin.
those kinds masuk angin and things like that. Okay, now we must understand that they're either recovering from a perineal wound or they're recovering from a cesarean wound. Now, can you imagine your body, no bath, no nothing? You're at higher risk of causing infection to all the sites, right? So, so you need to have your shower, you need to keep your body clean, and you're breastfeeding. Your baby is constantly going to your breast. So you need to keep your body clean, right? And coming back to the massages, I would advise for the massages, yes. But for those who have had a normal delivery and they keep pressing on the uterus and saying, oh, your uterus is not getting smaller yet, I need to put more and more and more strength, that is a myth, because your uterus involutes on its own. That means it goes back to normal size slowly on its own, with or without massage. Or without massage. That is a natural physiological process that happens in the body through that 6 weeks. Now, we have Europeans who also deliver, right? They don't have swam and all these things to make the uterus smaller, but they all involute, right? So it is a natural process.
Right.
So don't be in a rush to say, and say, oh, I need to, keep putting too much of pressure on it. That's all not good. Yeah, just let it take its course.
Okay.
So there are some practices which are great, which I think there's no harm in following, but there are some that we need to be very cautious about.
And Doctor, what is the advice that you have for women out there who don't practice traditional confinement when it comes to caring for their health? What's your advice to them?
My advice to them is, I think you'll be all right, because in 6 weeks everything will actually go back to normal. All you need to do is practice a very, very balanced diet, have adequate amounts of fluid, go about doing your day-to-day activities as as much as you can, because you have a lot of other things that you need to do now. Keep mobilizing. Make sure you maintain good personal hygiene, regular pad change, have your shower. If you have a perineal wound, I always advise a sitz bath wherein they sit in this salt water in a big basin, to help keep the perineum clean, and avoid areas of large crowds in your confinement period, because your immunity is just returning back to normal. You very easily pick up an infection, and anything you pick up goes to the baby, right? And last but not least, please ask for help when you need it. Do not overstress yourself, and do not think that you need to do this all on your own because you're the mother. There's a father, there's a grandmother, there are people around you. All you need to do is communicate with them and tell them what you need, because it's difficult to just expect them to do.
Right, absolutely.
Yeah.
Dr. Sai Sudha, thank you so much. It was such a great pleasure having you on air and shedding some light on all of these important things. You helped us debunk a lot of myths. We learned about, coffee being good or not for pregnant women. You also spoke to us about, the postnatal care and the confinement care. All these things, I think, was very insightful, and our listeners would have got a bountiful of information from our conversation. And we thank you so much for setting aside your time this morning. Thank you, Doctor.
Thank you for having me, Anil. I really hope that this talk has got some benefit to all the mothers out there.
Absolutely. You have a lovely day, Doctor. Take care. Bye-bye.
You too, Anil. Thank you. Bye-bye.
Bye. All right, and that was a very enlightening conversation I had on today's edition of Health on Tracks with Dr. Sai Sudha. She's a consultant obstetrician and gynecologist at Pantai Hospital, Ampang. And today, Dr. Sudha spoke to us about maternal health in pregnant women above the age of 40. Very interesting topic here on Health on Tracks. Moving my attention right now to the clock. We are about less than 5 minutes away from the clock striking 12 o'clock in the afternoon, which means shortly we'll be crossing over to the RTM News Centre for the 12 o'clock news updates. And then right after that, Anil on the mic. That's me. I'll be back with you for the third hour of Tracks Momentum. Keep it right here